Hi, this is Rockey again, and as a follow-on to a video I made regarding what we refer to as the periodontal pocket and periodontal probing. This is the periodontal chart that we create with the values that we obtain by doing the probing. Now you'll remember we talked about the wall of the tooth and the tissue next to it forming a pocket, and as I said, when you smile and your gums scallop around your teeth like that, they don't attach to the tooth right there. They attach to it at some distance below, creating what we refer to as a periodontal pocket. And again, with the wall of the tooth, the tissue attached to it, and the attachment some distance below the crest that you see on the outside. And the way we, one of the ways we judge periodontal health is to measure the depth of that attachment, measure the depth of that pocket. And we have a special hand instrument that's measured in millimeters that allows us to do that. And from that information, what we do is we create what we refer to as the periodontal chart. And this document is really important to document the health of your gum tissue when you come in every time. And we usually do this yearly, and then we alternate it with x-ray pictures, so we throughout the year have a pretty good idea of how you're doing. So if you're a normal 6-month recall, we take pictures at one 6-month period. 6 months later, we do the periodontal charting, and with those two documents, we can see kind of how you're doing. So in this particular case, you may have seen the video where I talked about the number of 3 millimeters being fairly healthy, and the significance of that is that 3 millimeters is about the extent to which you can clean down under the gum in that pocket area to sweep the bacteria out, sweep the debris out, to keep the bacterial loads and the bacterial colonies from growing in there, to actually cause the progression, starting with gingivitis, meaning inflammation in the gum, bleeding and swelling, to eventually to bone deterioration in the bone, bone loss, deepening of the pocket. That's the normal progression of periodontal disease, ending up with bone loss. So 3s we like, 4s and 5s are getting deeper, and 5 millimeter pocket is something, even a 4 is probably bleeding. These marks here indicate bleeding, so we know you've already got irritation of the gum tissue. We know, in my opinion, if you have bleeding gums, that only means one thing. That means bacteria, elevated levels of bacteria in there, which you're not able to clean out. And then as we progress further back in the mouth and with the deeper numbers, we know that you are getting loss, starting with a loss of bone in between the teeth. Now, we'll want to treat this, and we suggest ways to do that, and that's a subject for another day. But you'll notice one of the key takeaways here is that in each number here represents a tooth, tooth 2, tooth 3, tooth 4, or 5, of course, and the line here represents in between, and you'll notice that typically the numbers are deeper in between. Well, why would that be? That would be because when you brush your teeth, you can clean the side where the cheek is, you can clean the top of your tooth where you chew, and you can clean the inside by your tongue. But if you're not really diligent or not really able to clean in between the teeth, that's where the bacteria like to harbor itself. That's where the disease progresses faster and more severe. And so this is very typical, that the problem would be in between the teeth. The patient is not really able to clean in there, or not flossing in there, not getting in there further, maybe not using an electric toothbrush. We in particular like a Sonicare toothbrush, which helps get in here better. But this is sort of a classic case of early periodontal disease. Pretty good in the front teeth, your 6 front teeth, and then we get to the back teeth, and really in every quadrant of your mouth we have more or less the same problem. 4 millimeters and 5 millimeter pockets in here, which are indicating certainly problems with the gum itself, and then the 5 millimeters indicate just the starting of bone loss in between there. So we will want to treat that, and allow it to progress here. Bone loss will continue at some pace, and that's really why you want to get on it. So this is a very important document that we generate with those probing depths, with that instrument that we place in there that everyone says we're poking you. But just know that the data that we get from that is one of the main tools we use to check on the severity or diagnose the severity of the gum problems that you're having. All right, thank you very much.